Welcome back to Midday Kentucky, everyone. Well, Dr. Henry Wells, board-certified plastic surgeon from Wells Plastic Surgery and Skincare, is here to talk about eye rejuvenation. Welcome to the show, my friend.
It's great to be here, Tori.
Good to see you. I always think there's a lot of options out there for men and women when it comes to eye surgery. Not just surgical, but also non-surgical. So today we're going to talk about surgical.
Exactly.
Why do people seek out having eye surgery to begin with?
Well, Troy, you know, the first thing people see when they look at you are your eyes. They're the focal point of the face.
That's true.
And one of the first things people notice as they get older are puffiness and wrinkles around the eyes. And that's one of the first things that people see me for facial rejuvenation.
Okay, so I'm going to actually say the word incorrectly. What is the medical term for eye surgery?
Blepharoplasty.
Okay. I knew and I'm not even going to try and say it, but let's talk about what it actually is.
Well, a blepharoplasty is a procedure that removes excess skin from the eyes, or for the upper and lower eyelids, and it removes excess fat from the upper eyelids and can either reposition or remove fat from the lower eyelids.
Okay, so you can have just lower if need be, but
sure.
Do you recommend having both, or is it really case by case?
It's case by case. Some patients really have great looking lower eyelids and have extra skin in the upper eyelids, and
Yes.
they're perfect for just upper lid blepharoplasty.
Okay, I think it's probably one of the best investments one could make on themselves. Explain to me about the downtime. Let's start off with the procedure to begin with. How do we prep for it?
Well, the surgery is done as an outpatient procedure, and there's very little prep for it. Obviously, you have to have good eye health. We sometimes ask that our patients see their ophthalmologist for an examination before they have the surgery. But it's an outpatient procedure, and it can take anywhere from 2 to 3 hours to do. And then the downtime, most patients with upper eyelids will go back to work after about a week. With lower eyelids, there's a tendency to swell a little bit more, so it can take a little bit longer for them to recover and go back to work.
Oh, okay. So one of the things that I often think about, and I've often been told by doctors like yourself, that it's always good to take arnica a week before as well to help with the minimal of the bruising.
Well, I tell my patients to take arnica after the surgery.
Oh, do you?
Yeah,
And
to improve, it increases the circulation and removes the bruising. Yeah.
Interesting. Okay, so let's talk about pricing for everyone at home. Now, it's not a crazy price, really. 2 eyelids are $2,600.
Exactly, that's a surgeon's fee. Now, depending upon where the surgery is done, whether it's in the office or in a surgical facility, the prices can vary for that. But the surgeon's fee is usually around $2,600 for 2 lids and $3,900 for 4 lids.
For upper and lower. Talk to me a little bit about, we were just looking at some incredible before and after shots that we saw up on the screen while we were chatting. Now, we've talked about the surgery. You were saying about 2 weeks, did you say, for downtime? But that doesn't mean you can't go back to work.
Oh, no. Most patients, like I said, after upper lid, upper lid blepharoplasty, they'll go back to work after a week. We have our patients come in for makeup and camouflage makeup, and they can go right back to work after a week.
Let's touch on very softly regarding some injectables that we could do, that if you're not quite there yet, wanting to have the surgery, but you're wanting to have a few injectables, what can we do for under the eye?
Well, for example, we use Botox to erase crow's foot wrinkles and wrinkles between the eyes. We can also raise brows with Botox. We use microneedling to smooth out the crepey skin in the lower eyelids. We use filler to enhance the volume of the cheek, and that smooths out the junction between the lid and the cheek. So there are a number of non-surgical fillers, and injectables we use.
That's for everyone out there that just want an introduction into it as well. And, you know, we all know that most of those injectables now that we do around the eye, you know, apart from Botox, can last up to a year or even a little bit longer. Then they can have a conversation with you, get used to the whole idea, and then maybe you have that little bit of a surgery. I think it's fantastic.
Well, great.
It's the next thing that I want to do for me. I think it's just a great procedure. We really appreciate you coming in again. If you want to find out more information about Wells Plastic Surgery and Skincare, there's all the information up on the screen now. Guys, head over to their website. It's a really great website. It gives you really good information. Or just give one of the office girls a call and they can set up a consultation with you. 859-255. There's his number up on the screen right now. We appreciate you coming in. We'll be right back after this short break.